before we begin, I would just like to note that this research is actually part of a larger project that is focusing on using the Planet Youth data to hopefully help inform suicide prevention and mental health promotion, and it's led by my colleagues Dr. Bernadine Brady and Caroline Heary from the University of Galway, and it also involves wider partnerships with the HSE, National Office of Suicide Prevention, the NSRF and the Western Region Drugs and Alcohol Task Force. Now, this particular research element focused on looking at the relationship between youth adversity, suicidality and self-harm. And when we were carrying out the research, we were very much guided by 4 key objectives. So we wanted to examine the rates of suicide attempts and self-harm reported by young people in the west of Ireland. We also wanted to learn more about the types and patterns of adversity that young people experience and determine whether there is a relationship or a link between the patterns of adversity young people experience and their engagement in suicide attempts and self-harm. And lastly, we also wanted to identify some of the resources or strategies that can help protect young people. So the factors that can help mitigate or lower their risk of engagement in suicide and self-harm. To answer these questions, we analysed the data from both the 2020 and the 2022 Planet Youth surveys, which included responses from 10,281 young people from across Galway, Mayo and Roscommon. Now, just to note, we did use the full Planet Youth sample. So in terms of the characteristics in this study, about 88% of the young people were aged between 15 and 16 years, and about 49% identified as being male. Okay, so looking at our first objective, why were we interested in the concept of youth suicide and self-harm, or why did we think this was an important topic to investigate? Well, both nationally and internationally, youth suicide and self-harm have been identified as major public health concerns. According to the CDC, suicide is one of the leading causes of death for young people between the ages of 15 and 19 years of age, and accounts for approximately 23% of all deaths for adolescents among this age group. Recent evidence from cross-cultural comparisons suggests that approximately 6% of young people will attempt suicide and 22% engage in non-suicidal self-injury over the course of their childhood and adolescent years. And worryingly, evidence from our researchers and practitioners indicate or suggest that incidents of self-harm and behaviour among young people may be on the rise or may be becoming more prevalent. And when we look at evidence that from research that has looked at temporal trends in suicide and self-harm behaviour, there is reason to support this. So for example, evidence from the US found that between 2009 and 2019, there was a 22.5% rise in rates of non-fatal suicide attempts among adolescents. And similarly, research from Ireland that looked at data from the National Self-Harm Registry found that between 2007 and 2016, there was a 25% increase in rates of self-harm among young people in Ireland. Now, what's important to note here is this data was taken from self-harm presentations at emergency departments and hospitals across the country, with many people arguing that these numbers may in fact just be the tip of the iceberg and that the true prevalence rates may be a lot higher. And so it's argued that we should also be looking at data and information collected from non-clinical samples or community-based samples as well. And so for me, I think one of the major strengths of the Planet Youth Survey is the fact that they're in every school. And this gives us a really important or unique opportunity to gain more insight into the rates of self-harm and suicide among a regional community-based cohort of adolescents. And when we looked at the findings from the Planet Youth 2020 and 2022 surveys, we found that approximately 9% of the young people surveyed reported having previously attempted suicide at some point in their life, and 32% reported having engaged in purposeful self-harm. Now, interestingly, we did not find significant changes in the rates of suicide attempts and self-harm between 2020 and 2022, but we did find significant gender differences in that across both years, girls were twice more likely than boys to self-harm and to attempt suicide. Okay, so to help us try and make sense of these prevalence rates, or why these rates appeared so high, that they were a little bit higher than what we've seen in other comparable research surveys, we wanted to look at the factors that place young people at risk, or what was contributing to their risk of engaging in suicide and self-harm. And I think it's important to note that while suicide and self-harm are complex and dynamic behaviours, so they're influenced by the interaction between multiple different biological, psychological and social factors, there is evidence to suggest that childhood adversity or exposure to early life negative events is one of the strongest and most important predictors of suicidality and self-harm. And because adverse experiences are also thought to be quite prevalent during adolescence, whereby it's estimated that between about 50% of young people will experience at least one adverse or traumatic event before they reach adulthood. It's argued that this is an important area for prevention research, with groups like the Irish Prevention and Early Intervention Network specifically calling for more research looking at the nature, prevalence and impact of adversity within Irish society. But it's also argued that we need to think more about the best way to measure the impact of adversity on young people, with researchers claiming or identifying two potential limitations associated with the way adversity has traditionally been defined and measured. So when we look at research on adversity, a lot of the research focuses on measuring adversity within the home context, often conceptualizing adversity in terms of household dysfunction, abuse or neglect. And some researchers have suggested that this definition of adversity might be overly restrictive, in that it neglects to consider the impact that traumatic experiences outside the home, so things like being bullied or being the victim of peer victimization may have on young people, and that having a broader definition of adversity might be beneficial, or might give us more insights into the impact it has on young people and adults. The second limitation has to do with how we have traditionally looked at the impact of adversity. So again, much of the work in this area looking at adversity has relied on what's called the cumulative risk model. So this is essentially a dose-response approach, which looks at the sum numbers of adversity that a young person has experienced, with research suggesting that the risk of experiencing negative health outcomes increases in tandems with the number of adversities one experiences. And despite the popularity of this approach, there may be certain limitations associated with this model, in that it doesn't consider the impact of specific types of adversity and the impact that might have on the young person. And it seems to it assumes each type of adversity has the same weight or carries an equal impact on the young person, and it fails to consider how specific combinations of adverse experiences may impact risk. So in our research, we wanted to try and address some of these limitations or broaden the way adversity research has traditionally been conducted. So we wanted to look at the types of adverse experiences young people encountered across home, school and peer contexts, and we wanted to look at the patterns or the co-occurrence of adversity across these different contexts. So to do this, we identified 16 questions which looked at young people's negative life or adverse experiences at home, in school or with their peers. And we found that a large percentage of young people reported experiencing adversity. So next, in order to look at the combination of experiences or the co-occurrence of adversity, we carried out what's called a latent class analysis. And this is just a type of analysis that looks at patterns or associations between the young people's responses on a set of questions. So for example, if a young person responded yes to question 1, what other types of questions were they likely to say yes to? And when we did this, we found that we identified 4 dominant patterns of adversity. In other words, we found that young people could be broadly categorized into one of 4 groups based on their probable history of adversity. So the first category we found was what we labelled the low adversity group. And this is because young people in this category had a high probability of not experiencing adversity. So they were likely to say no to each of those 16 adversity questions. And this was in fact the largest cluster or category we found, with about 49% of young people falling within this category. The second group we found is what we called the parental adversity group. And the young people in this group were characterised by a likelihood of experiencing adversity with their parents. So they reported things about either witnessing conflict between parents or experiencing conflict with their parents. The third category is what we labelled the peer adversity group. And the young people in this group appeared to have a high likelihood of experiencing adversity with peers. So they reported things like being teased by a group, being rejected by their friends, being bullied, or experiencing a breakup with a romantic partner. And finally, the last group we found, which again was the smallest group, about 10% of young people fell into this category. And these young people were characterised by the likelihood of experiencing adversity across multiple settings. So they reported experiencing adversity at home, but also at school and with their friends or with their peers. So after identifying these four kind of dominant patterns of adversity, the next thing we wanted to do was we wanted to look at whether there was a difference in risk of suicide and self-harm behaviour across each of these four adversity groups. And the figure here shows the rate of suicide attempts and self-harm behaviours reported by adolescents in each category. And as you can see here, we found that there was a significant and substantial difference in risk of suicide attempts and self-harm across the groups, with the young people in the low adversity group reporting the lowest rates of attempted suicide and self-harm, while the young people who experienced adversity across multiple settings showed the highest rates of attempted suicide and self-harm. Specifically, young people, in comparison to the low adversity group, young people who experienced parental-based adversity were 4 times more likely to self-harm and 5 times more likely to attempt suicide. Those who experienced peer-based adversity were 6 times more likely to self-harm and 10 times more likely to attempt suicide. And those that experienced adversity across home, peer, and school settings were 30 times more likely to self-harm and 60 times more likely to attempt suicide, indicating that this group, the young people that experience adversity across multiple settings, appear to be in a priority group for intervention and prevention. Okay, so lastly, I suppose our final goal of this research was we wanted to understand more about the protective factors. So what helps? What can we do that can help mitigate or buffer this risk of suicide and self-harm? And while in general we seem to know more about the risk factors for suicide and self-harm than we do about protective factors, what we do know is that protective factors operate at multiple levels. So they can occur at both an individual level and they also occur or operate at the kind of wider social level. So for example, research shows that personal practices like sleep or exercise can help promote health and well-being. But other research also shows that factors like community or relational resources, like social support or having access to a safe place, may also help protect against suicide and self-harm. But in general, it's argued that what we need to know is we need to know how these protective factors work for both low and high risk groups. So what we did is we went through the Planet Youth surveys and we identified 5 potential protective factors, and we looked at how each of these 5 factors, we looked at whether they were associated with lower risk of suicide and self-harm, but we looked at this relationship across each of the 4 adversity groups that we identified. And when we did this, we found some interesting results. So first, we found that there was actually no significant relationship between friend support and either suicide or self-harm behaviours. While we did find some evidence that physical exercise acted as a protective factor, we found that greater physical exercise was associated with lower risk of self-harm, but only for the young people in the low adversity or the low risk group. And we didn't find a relationship or an association with attempted suicide. For our more kind of high-risk categories, or for the young people that had experienced adversity, in general, what we found was that higher levels of parental support, greater feelings of safety at school, and more hours of sleep each night were associated with lower risk of suicide attempts or self-harm. But in general, the significance or magnitude of the relationship did vary depending on the outcome we were looking at, which suggests that either protective factors work differently for self-harm and suicide, and also potentially that protective factors might work differently depending on young people's prior exposure to adversity. Okay, so just to finish up or conclude, we are still trying to digest some of these research findings, and we still need to think more about the key findings and the implications emerging. But for me, I think some of the findings that struck me or that I thought were important was the fact that we found high levels of suicide and self-harm among young people in the west of Ireland, which indicates that this is an important area that is in need of more research and intervention and prevention. The second finding is that when we look at adversity, there is evidence from this research to suggest that it might be important to consider the context of adversity. So we need to think more about the context in which young people are experiencing adverse events, because in our study, young people who experienced adversity across multiple settings were at substantial risk of engaging in suicide and self-harm. And finally, while I think we still need to do more about that protective piece, and we need to think more about how we can support young people and how we can support those that have experience of adversity, preliminary findings suggest that maybe both personal behaviours and relational supports might play a role in reducing risk of self-harm and suicide. So apart from that, I just want to say thanks, and if anyone else has any suggestions or ideas about the research findings, I'd love to hear it, because I know there's a lot of expertise in the room, so it'd be really interesting to hear what you think. Thank you.